Hi, this is Dr. Lin. Today we're going to talk about gout and arthritis. There will be three types of gouts that we're going to talk about today. And we're going to talk about the causes of different gouts. We're also going to talk about what ways to examine it to make sure you have gout or what type of gout you have or arthritis you have. And we're going to discuss treatments for arthritis and gout. A lot of patients, when they come to me, they have severe joint pain, especially finger pain, stiffness, swollen, couldn't move in the morning, severe pain, couldn't do any work, severe pain at the toes, swollen toes, pain at the toes, no range of motion at the toes, they couldn't walk because of the pain. And they have gone through medical doctors, rheumatologists, they have gone through physical therapy, injection, acupuncture, chiropractic, massage, even taking painkiller. Nothing worked. And the medical doctor told them that there is nothing that they could do, that they will have to live with the pain and die with the pain. And there is no cure and there's no treatment to this kind of thing. And all they do is stuff them with pills and medications, which give them tons and tons of side effects. A lot of patients, when they come to me, they have no other options. Because I'm their last hope. They have no other hopes. Because they're living with pain so long. Okay? I want you to know that there is hope. There's hope of healing. There's hope of total recovery. But it's up to you and me, especially you, to keep searching, finding out the right method to help you to get your joint pain and gout better. The first type of arthritis, we call it osteoarthritis. Osteoarthritis is associated with aging. When you're old, when you are 50, 60, 70, your hands start to have joint pain. And when you have joint pain around the joint, and you go take an X-ray, and you'll see there's a lot of, how do you say this, overgrowth of bones around the joint. And when there's overgrowth of bone shown on the X-ray, then we know exactly what it is, and we know it's an osteoarthritis. Because whenever you get old, a bone gets degenerated. When the bone gets degenerated, these we call it osteophyte or bone spur, they come out of the joint and start causing a lot of pain and discomfort. Okay. Not only does it cause pain, it also causes a little swollenness as well too. And also, if you look at the next film, when your bones get degenerated, there are cartilages around the bones and collagens. And when these collagens and cartilage grinding against each other, the surface, they become worn away. Cartilage worn away, and they become degenerated. And more degenerated they are, the more painful, the more stiff, the more swollen. And the swollen is because of the edema, because of the blood vessel that was broken, the capillary that is not working, that's broken. And the water came out of the joint. That's causing the swelling of the joint. Okay. The other type of arthritis is called rheumatoid arthritis. Now, rheumatoid arthritis is very similar to osteo. The rheumatoid arthritis does not come with age. People as young as 20s and 30 can have joint pain, can have swollen of the hands and feet. And the difference, one of the difference is that rheumatoid arthritis, you cannot see on the X-ray of any bone spurs. There is no degeneration of the bones. There's no, because you're still young. You're still young. Okay. Main thing is the inflamed synovial membrane, which is the membrane surrounding the joint, they're inflamed. They inflame because of a lot of different conditions. One of the main reasons why it causes inflammation is because of the autoimmune response. It means that the body's immune system is going so bad, it's going so low, that the immune system of the body is attacking their own finger joint, attacking their own foot joint, therefore causing a lot of pain, discomfort, swollen, even deformity. You see your finger become so crooked and you can't even use it anymore. Okay? This can be prevented. If you find out early you have arthritis, if you have any kind of pain, and you had it for maybe a year or so, or maybe a few months, it's not going away, and your joint is swollen, you got to come right away. You got to seek any kind of medical assistance right away before it becomes deformed. Because if you don't do that, if you don't find out that your immune system is attacking your joint, if you don't find out, it's going to get worse and worse and worse. No matter how many medication you take, if you do not find out the cause of the problem of the rheumatoid arthritis, then no matter how many medication, no matter how many injection, no matter how much drugs you take, it's not going to get better. Okay, now I'll tell you exactly how you should and what you should do to find out whether you have osteoarthritis or whether you have rheumatoid arthritis. It's very, very simple. Okay? The symptom of RA or rheumatoid arthritis, inflammation of the joints, we just discussed that. Morning stiffness, fatigue, muscle joint pain, bilateral and joint deformity. Now, one of the major signs of the RA or rheumatoid arthritis is that it's bilateral. It means that you have it both hands, you have it both knees, you have it both foot, you have it both shoulder or both elbows, or both wrists. Rheumatoid arthritis can cause pain at any part of the body, any part, not just the finger. But because the finger is much more, how do you say this, pronounced. You get much more symptom out of the finger. That's why more examples are shown around the finger area. Gout. Gout is purine, deposit of the crystal around the big toes. Over 90% of the gout symptom happen at big toes. And because of the deposit of the crystals. Now the crystal is because you have too much purine in your body, and the purine level is not going away. The body is not excreting, it's not taking away the purines in the body. That's why deposit in the joint. It could be at any other joint as well, but it's just most pronounced at the big toe. There's a lot of food that causes the problem with the gout or increases the symptom of gout, including alcohol, red meat, seafood, beans, and other more specific food we'll discuss later. Okay. Symptom of gout is same thing, very similar. The gout and arthritis is almost the same. Joint inflammation, swollen redness, pain, fever, symptom usually at night, and in the morning, stiffness in the morning as well too. Okay. We just talked about the major differences, right? Let me say that again. Osteoarthritis, you can see it in the X-ray, and they are bone on bone spur for the osteoarthritis, bone on bones. Rheumatoid arthritis, there is no bone on bones. The bones are intact, the bones are great, the bones are looking great. But it's the synovial joint, the fluid that's inflamed, causing the swollen and deformity of the finger joint, of any kind of joints. And gout, again, is the deposit of crystals within the gout, causing erosion of the gouts. Okay, so these are the three major differences of the different type of arthritis and gout. Okay. There's so many different causes, which we will start discussing them one by one in more detail. Aging, of course, obesity, if body is too much weight, too much fat, it's going to cause issue. Overuse, if you use your hand over for a long time, yes. Muscle weaknesses, if your muscle is too weak, you couldn't protect the joint. Drug interaction, and there's much more. Okay. Now, drug interaction means that there are a lot of side effects. Let's say, for example, you're taking cholesterol medication, or you're taking any kind of anti-cancer medication. A lot of these medications they cause side effect, which causes joint pain, which causes inflammation of the joint, which decrease our immune system, and our immune system start attacking the joint. A lot of it is coming from the drug interaction. So if you're taking more than 5 or 10 different medications, please look over the side effect. Please discuss that with your medical doctor, whether it is causing joint pain or not. Very, very important. If you do not take away the effect of the medication, no matter where you go, no matter what treatment you seek, it's never ever going to get away. Even you have surgery, even you took the joint out, still in your blood, it's still going to cause, we call it phantom pain. Okay, phantom pain means if there's no joint, there's pain. Okay. Like I said, the primary issue that causes the joint pain, especially the rheumatoid arthritis, is the autoimmune system. Now, autoimmune system can also attack your joint because of osteoarthritis. It's also because of the gout. It can also affect those as well too. Any type of arthritis, it can affect it by the autoimmune system. Autoimmune system again is bacteria, viral, parasite, germs, toxin, viruses, pollution. All these outside environment come into the body because the body is overwhelmed with all these bad stuff, and body can no longer attack these bad stuff, and for some reason the body is mutated, the gene mutated. The white blood cell no longer recognizes these as foreign substance. It recognizes your joint or your toes or your whatever joint in the body is a foreign substance. It starts to attack them. That's why you have pain, that's why you have swollen, that's why you have all these bad symptoms. Okay, so we gotta deal with this. We have to deal with the autoimmune issue, because if you have autoimmune issue, your finger joint is not the only stuff to go. It's not. Your brain, your thyroid, your blood, your gut, your nerve, your lung, your skin, your muscles, everything is affected. And then the entire organ, not only just the organ, but the spine. Your immune system will attack all the other area of the body, and you're going to suffer. Not just the joint pain, but pain all over. They call it fibromyalgia. It's like all over pain. And you have fatigue, and you have, dizziness, and everything. Okay, now I'll tell you exactly how to find this out. Please continue. Inflammation is one huge things that causes the joint pain. Okay, inflammation comes from where? Sugar. Majority of inflammation comes out because of the sugar issue. Too much sweets. Okay, why? Please go on the internet. Type and research yourself how does sugar increase inflammation. Okay, you'll see. Because clinically we have seen a lot of patients when they take way too much sugar, the joint pain just comes on, and there are pain with people with pain that's on and off. Pain for 1 minute and it goes away in an hour, another come back again for another few minutes and goes away in an hour. Just on and off, and just day by day, year by year, just like that. And for no reason, the pain with joint will swell up like a balloon. And for no reason, after a few days, the joint pain goes away. Why? Because the majority of the issue is also caused by the food, the diet that we eat. Diet, that's very important. So we gotta be careful if you want to get a total healing, if you want to get a treatment for anybody. Okay, your food has to be a part of the healing process. Has to be part. Nightshades. Nightshade cause inflammation. Okay, such as peppers, eggplant, tomato, green pepper, bell pepper, potatoes, and there's others. This is just one of the few major ones. Okay, so avoid these by all means. Avoid these. Sometimes if you just by avoiding these food, you are going to get a miraculous healing just by avoiding these diets. You'll see. If you don't believe it, you'll see. Try it out yourself. Toxicity. Now we're living in a toxic environment. I call it toxic soup. You see the soup, there's industrial toxin, there's oil toxicity, there's medication toxicity, there's alcohol toxicity, there's drug toxicity, and there's the garbage toxicity. We are all swimming in the toxic soup. There's no way to get around it. There's no way to get out of it. Okay, that's the reason why of all these toxins is causing our immune system to not working, and therefore causing severe joint pain. Toxicity. Okay? Like I said, bacteria, fungal infection, viral infection, parasite infection, okay? All these infections. Now, if your immune system is strong, our immune system has the ability to attack and kill and eliminate these issues. But if your immune system is low, these, when they come into your body, will also attack your joint and causing a lot of pain. Okay. pH is a huge issue because, again, we're living in a toxic world. A toxic world are just full of acidity. For example, hamburger. The bun, the meat are acidic. Candies, bread, pasta are acidic. Red meat are acidic. Okay? The only alkaline food is vegetable, which most people do not eat, green vegetables. Okay, so you gotta have a balanced diet. Gotta make sure that your pH level is okay. If your pH level is way up here, very acid, then you're gonna have a lot of severe pain that nobody will be able to take care of unless you take care of the pH level of the body. And very simple. You can just get a little tag, put in your tongue, test it under urine, or sometimes even the poop, or some of the blood. You can find out if your pH is high or low or middle. Okay, it cannot be too low. It has to be in the middle range, which is about 7. If the pH is about 7, for some patients, there are some patients, even just controlling the pH, the pain goes away. The muscle pain goes away. The joint pain goes away. Okay. Deficient in nutrient. Our patient said, when I see some of those patients and I test them and I told them you're deficient in a lot of different nutrients, and they told me, we eat healthy, we eat the food, everything we eat, the market, and we cook ourselves, but why are we still deficient in nutrient? Okay, one of the major causes of the nutrient deficiency is our soil. Our soil, if you imagine that, the soil now compared to soil 100 years ago, there is no nutrient because it's been soaked with pesticide, been soaked with chemicals, it's been soaked with chemical preservatives. Okay, and not to mention the pollutions. Everything has been soaked under the soil. There's so many toxicity in the environment. Do you think the soil will retain as much the nutrient as it used to be? No. So the nutrient of the food that comes out of the soil now, it's about 10% compared to 100 years ago, it's about 100%. That's why we're so missing the nutrient. That's why our body cannot get the nutrient, our body cannot heal. We get tired, we get fatigued, we get joint pain. The body cannot heal because the body does not get the fuels that it needs to process, to function. Okay, that's why having a good food is so important. Having a good diet is so very important. Okay, enzyme digestion. How does that relate to the finger? Yes, of course it does. If let's say you eat the food comes into your mouth, pizza, whatever it is, hot dog, comes in, and there's no digestion, there's no enzyme to digest the food. The toxicity of the food, or whatever junk is of the food, is going to stay in the stomach. It's going to produce a lot of bad bacteria, right? Fungal, parasite, bacteria, virus. It's going to be produced in the stomach, and all these infections is going to go into the joint, finger joint, whatever joint in the body. It's going to start attacking those joints because your stomach did not process them. The stomach does not eliminate these stuff. Okay, that's why digestion has to be good. We gotta poop every single day. Okay, we gotta have enough enzyme in our system to digest all that stuff as well too. Okay, lymph circulation and also the blood circulation and drainage is another major issue because let's say if your body is able to eliminate, to kill the germs, bacteria, infection, but it has nowhere to come out. Let's say your blood circulation is not moving, your blood is not moving, stagnant. Your lymph circulation, your lymph it's not moving. Your lymph is like the lymph system is like a water pipe in the house. If your water is clogged, right, your toilet, your sink, it doesn't come down because of the clogged pipe. Okay, our lymphatic drainage system is like a piping system. Okay, if the lymphatic is clogged up, all the junk cannot come out of the body. The circulation, if it's so stagnant, the blood's so thick, the junk cannot come out of the blood, therefore causing a lot of joint pain, muscle pain, whatever pain. Okay, this too has to be fixed. Major. Okay, now trapped emotion, trauma, stress, they all add up to, to pain. Because when you have stress, when you have a lot of stress, our organ function comes down, our immune system goes way down, our blood circulation stops, our lymph circulation stops, our body ability to process the toxin and sugar and the food stops. Everything stops function, and the cancer grows. Okay? And there are cases where people that have cancer and they go on live a stress-free lifestyle. And just by living in that kind of lifestyle, the cancer goes away. I mean, not everybody, but there are some cases which reports that way. So you can see how strong the emotions, how strong the stresses of our daily living can affect the function of the body.